Good afternoon, ma'am. My name is Josh. I'm going to be your student physical therapist today. Can you please go ahead and verify your name and your date of birth for me?
My name's Betty, and I'm 16 years old.
Okay, Betty. Well, what brings you in today? How can I help you?
I've just been having this really bad hip pain, and over time it's just gotten worse to the point where I feel like I needed to come to physical therapy.
Okay. How long has this been going on for?
Honestly, kind of a long time, but when it started maybe like a few years ago, it wasn't too bad, but now it's really like I can't do a lot.
Okay, so it's gotten progressively worse over
Yeah.
time, you'd say?
Yes.
And whenever this first started bothering you, did something happen? Did you fall? Did you run into something? Or did it just kind of come on its own?
No, I mean, I'm pretty active. I race horses, so, I mean, I've fallen off before and things have happened, but it wasn't like there was a specific time. And then this started, it was kind of just like over time.
Gotcha.
It came on.
Okay, and so has this pain limited your ability to ride horses and do like other activities?
Yeah, because when you're riding the horse, you're in a squat position, so that's pretty much what brings on the pain. But I also have to take care of other animals, so like bending down, picking things up, it also brings it on. But it's the worst when I'm riding horses.
Okay, so it's really anytime like that hip is in a bent position. You
Yeah,
feel it.
that's when I've noticed it the most. Yeah.
Okay.
But then also, like sometimes I don't even have to be doing anything, and that's when I was like, I need to go to PT because
Okay.
I can just like I can't even like cross my leg up anymore. Well, I can, but the pain will increase a lot.
Gotcha. Do you feel it right now just sitting here?
Right now it's not too bad because I haven't really been sitting that long.
Okay.
But if I was here for a long time, then yes.
Okay. Can you show me where exactly the pain is?
It's kind of like here, a little bit in the front, but also like a little on the side. Like it's not in like
Okay.
one specific like pinpoint. Kind of just like it almost like wraps here.
Gotcha. And so how would you describe that pain? Is it sharp? Is it
Yeah,
aching?
I would say it's pretty like sharp,
Okay.
especially when I like go into that position. It's like
That aggravates it.
Mhm.
Gotcha.
Yes.
Okay. So what kind of things, I know that you've kind of listed out, anytime that hip is bent, is there anything else that you notice that really aggravates the pain, flares it up?
Not that I've really noticed.
Okay.
That I can recall.
Gotcha. Is there anything that you do that makes it better whenever it flares up?
Pretty much avoiding all the things that bring it on, and like when I sleep at night, like it feels pretty good, and I
Okay.
think it's just because I'm laying down, so it's like pretty straight. And like when I wake up in the morning, feels good, but then I feel like when I'm trying to do the things I want to do, it gets worse again.
Gotcha.
So I haven't really like iced it or anything like that, but yeah.
Okay, so really just keeping that leg straight,
Yeah,
avoiding that bending
pretty
has been
much
good
that.
for it. Okay, and so you said you are having only a little bit of pain right now. If you had to rate that pain on a scale of 0 to 10, 0 being completely fine, 10 being bad enough to go to the hospital, how would you rate it?
2.
2?
Yeah.
Okay. Over the past 2 to 3 days, has it gotten down to a 0? What's the best that it's been?
Yeah, I would say there's points where
Okay.
it gets to a 0. Probably when I like wake up.
Gotcha. And that's whenever you have like that leg straight all night. It gets
Yeah.
better?
Yeah.
Okay. Whenever you're riding the horses, is that usually the worst that it gets?
Yeah, it probably gets up to like 8 maybe.
8? Okay.
And like it won't really stick around for too long, but
Gotcha.
like if I stop the activity, then I'm usually okay.
Okay.
But sometimes I can't stop, so.
Whenever you do stop, how long would you say it kind of takes that pain to calm back down to that to manageable levels, either like that 2 that you're having now or that 0?
I mean, it depends, but I would say like 30 minutes, maybe. Like, it's not like an all day thing. It's pretty much just like it takes a little bit and then it's usually fine.
Gotcha. Okay. And so, any difficulties? I know you said you had difficulties like bending over. Any difficulties just standing and walking?
I mean, sometimes walking can hurt, maybe if I'm walking a long time, but I'm usually okay with standing and walking as of right now.
Okay, good. Is there anything else that you can think of about your condition or anything that you've experienced that you think would be important for me to know?
I don't think so.
Clicking, popping?
Every once in a while, but it's not like a huge issue for me. I
Okay.
feel like it's like the pain is the worst thing that I noticed.
Okay,
Yeah.
but no other symptoms than what you described?
No.
Anything in your other leg, or is it just on that right side?
No, not really that I've noticed, but when I get on the horse, this is the leg that I get up with.
Okay.
So I feel like maybe that's why it's happening on this side
Gotcha.
specifically. But yeah.
Okay. Have you tried leading with the other leg?
I have not. That could be a good idea.
Okay. Well, just a couple more questions I have. I just want to make sure we rule out anything serious. Have you had any recent unexpected weight loss?
Nope.
You didn't say you had any pain at night. Any waking up regularly? Any night sweats?
Nope.
Any loss of sensation in your legs or feet?
Nope.
Any issues going to the restroom?
Nope.
All right, perfect. So some common epidemiological findings that you'll see in patients with FAI, you'll usually find that they're younger and still skeletally developing and maturing. So Morgan's character, Betty, was only 16, and so that's while those growth plates are still open, she's still developing. That's generally a time that FAI can occur. People that are also athletic, so in Betty's case, she was a horseback rider, taking a lot of force through that hip joint. That can be another cause of FAI. There can also be a genetic component and a history of trauma or childhood hip disease. So in the case of Betty, it could have been just repeated micro trauma from the horseback riding, taking a lot of force while she's riding through that hip. That could have led to the development of FAI as well. Some subjective complaints that you'll see from FAI patients, mild episodic chronic pain and dysfunction. So she had said that the pain had been going on for a while. It wasn't necessarily a new development, and that it had started out mild and progressively worsened the longer she had it. Like she pointed out, it was an insidious onset. There wasn't a specific traumatic event that happened that caused the FAI to start, but it was just a gradual buildup without any direct cause. And so those activities that required joint loading, hip rotation, and flexion, being in the saddle of the horse could have definitely led to that. There can also be complaints of stiffness, pain, clicking, popping, or catching. A common thing that we saw with Betty was that anytime she was in a hip flexion position, whether that was on the horseback or just in sitting where it wasn't as bad, she felt that pain, and that was also further confirmed through objective testing later on in the video. She did state that the longer she was sitting, the worse the pain would get, and then moving through the arc whenever getting up into standing can also cause that FAI pain. She did report that the pain was in the groin, and she did demonstrate a C sign. So what the C sign is you may have noticed in the video that she had her hand on her hip where the pain was. The C sign is exactly that. It's something that patients can use to indicate the location of the pain. So it will generally be on the anterolateral aspect of the hip. It can progress all the way into the posterior pelvis and the back. But a common thing to look for in patients is that C sign where they kind of grab their hip. Their hand is in a C shape. That's a good indicator for FAI pain. And then she also stated that she did have symptom relief in prolonged extension. So overnight, whenever you're sleeping in supine, whenever she was standing and her legs weren't flexed, the pain was relieved. So those are all common subjective complaints that you can see with FAI. Okay, Betty, if it's okay with you, I'm just gonna go ahead and do a couple tests on you, see if we can figure out what's going on with this hip, okay? Okay. So all I want you to do is go ahead and relax. I'm gonna move your leg for you, okay? So first things first, tell me if there's any pain, okay?
I mean, a little bit, yeah, with that.
Okay.
It's not excruciating.
I'm gonna go ahead and I'm gonna do something extra. I want you to tell me if this changed your pain, all right?
Oh, yeah.
All right, is that your pain?
Yeah, I'd say so.
All right, let me go ahead and let me bring you out of that. I'm gonna go ahead and I'm just gonna bring you up here a little bit. Okay. I'm gonna start to turn your leg. Tell me if this does anything to your symptoms.
Ooh, I don't like that.
All right.
I can feel them start a little bit to come on.
Gotcha, and that's your pain?
Yep, that's my pain.
Okay. I'm gonna go ahead and I'm gonna bring it out just a little bit. Tell me if there's any pain.
I mean, it's uncomfortable, not as bad as before.
Okay.
Yeah.
Is that still your pain?
Yeah.
Okay.
It's just like a little.
Excellent. Go ahead and tell me if this brings on any pain for
Yeah,
Just a little bit?
yeah.
Not as bad as the other side though?
Yeah, I mean, that's my pain, but it's not too bad.
Okay. I would then check the other side. Everything would be normal. Betty, can you go ahead and stand up for me?
Yes.
All right, Betty. So something I want to see you do for me is just go ahead and stand. You can widen your stance a little bit. And then I want you to go ahead, watch the table behind you. Just squat down as low as you can for me and tell me if that brings on any symptoms or anything.
Oh yeah, I can feel it down at the bottom.
That brings on symptoms?
Mm-hmm.
Okay, come on back up for me. Okay, then next, can you go ahead and I just want you to balance on one leg. Go ahead and balance on your left leg first for me. And everything is fine with that?
Yeah.
Good. Go ahead and now switch over to your right leg and tell me how that is.
Whoa.
You feeling it?
Yeah. It's just a little more difficult on this side.
A little bit more difficult?
Mm-hmm.
All right, if you're able to, and I can kind of give you the chair, I want you to just do a single leg squat. As low as you can.
Okay.
If you can't do it, that's okay.
Mm-hmm.
And I want you to tell me if that does anything to your symptoms, okay?
Okay. Oh yeah.
All right?
Yep, I can feel that.
You feel that? That's your pain?
Yeah, that's my pain.
All right, Betty, I think that concludes our testing.
Okie dokie.
Some common objective findings that you'll see with FAI is we didn't do it in the video because of the camera constraints, but just observing the patient, you can see some abnormal gait patterns with them, either the Trendelenburg gait or the lateral lurch, which are very similar to each other, but that's basically, you're going to see that pelvis drop, you're going to see the trunk motion restricted, either due to not wanting to put load through that affected leg where it's painful, or because of range of motion restrictions in the affected hip. Some things that we did do, we did a maximal squat test and a single leg squat on the affected limb. Both of those, putting load through the affected leg along with the combination of the flexion and rotation of the hip, can both reproduce that FAI pain that she was experiencing. Another common observation that you may see just during the evaluation is that the patient presents with a very slouched posture. Also, for testing, we did see that she had some range of motion restrictions for internal rotation of the hip whenever her hip was in 90 degrees of flexion on the table. And also, they will have pain with internal rotation and overpressure. So whenever I took her into internal rotation to her end range, I applied just a little bit of overpressure, and that was able to reproduce her pain. Two other tests that I also used to confirm that she had FAI were the Faber test and the impingement test, which is also essentially just the Fadir test. Doing both of those reproduced her pain, and along with the subjective, all of those objective signs and tests that I did, I was able to confirm that she had FAI because of that.